Debbie Mirander, and I'm your holistic health educator. And today I want to talk to you about a very important subject, and that is aneurysm. What is an aneurysm? An aneurysm is an abnormal widening or a weakening of any artery or vessels. This can lead to dangerous risks of rupturing. Now, when the aneurysm rupture, it can leak out into the surrounding areas of the body where the aneurysm is. Now, there is different types of aneurysms. There are an aneurysm called brain aneurysm. That is where the aneurysm is formed in the brain. And there is also what they call a abdominal aneurysm. This is actually the most common type of aneurysm. It is in the abdominal aorta, which leads from the heart down to the midsection of the body. And this is a very major vessel, and it carries blood throughout every part of the body. And like I said, aneurysm can form in the brain and in the abdominal wall, also in the chest area along that same abdominal aneurysm. It's called the aorta, aortic abdominal aneurysm. It's called AAA for that reason. There's also aneurysms that can form in the legs. Any extremities can form an aneurysm because the aneurysm is simply a weakening of the vessel, and it allows a ballooning effect of that vessel. And when the ballooning effect takes place because of the weakness, blood seeps into that area and really create pressure on that area. And then that potentiate a rupture, which can be very lethal. Now I want to get into some of the causes of aneurysm. Some of the common causes of aneurysms is advanced age. As we age, our vessels can tend to get weakened depending on what they are going through, whether they've been irritated by substance in our blood, but they can also get hardened, but in this case it actually expands and it probably gets softened. But it loses when it's hard, it loses that elasticity. When there's a weakening, it actually has too much elasticity, and it expands and forms this ballooning effect. Also, atherosclerosis can lead to the weakening of the vessels, which can lead to aneurysm. Now, atherosclerosis is a fat deposit that circulates in the blood system from the foods we eat and so forth, and it lodges into an area of the vessel, and when it lodges, it can create a blockage. Now, there is force going through that vessel, and so it's not surprising how that vessel can get weak, trying to really keep up with the pressure that's going through the artery as the blood pumps as the heart pumps the blood through that vessel. That area can get weak because the plaque is built up on the side. So aneurysm can be caused by plaque buildup, which is atherosclerosis. Some tend to say family history. I don't know if that has to do with genetics, because actually some people are born with aneurysm because they are born with these vessels already weakening. Also, high blood pressure can also put you at risk of aneurysm, and that is because the heart is really being pressured and it's pumping this blood, and there is various reasons why the blood pressure is high. One reason is that there is resistance in the blood vessels, and this creates pressure in that blood vessels, in those blood vessels. So the diastolic blood pressure, I did have a previous session on high blood pressure, and the diastolic is that low number of the blood pressure, and when that low number of the blood pressure, then the low reading happens, this is actually measuring the resistance in the vessel. So if you have a high blood pressure from your low number, it's probably a hint to your doctor that there is some resistance in those vessels. So high blood pressure can put you at risk of an aneurysm. They say that males tend to have more. I don't know why, because I actually know a female that have had a brain aneurysm. Fortunately, they caught it in time, and they repaired the aneurysm. So I don't really know why they say gender is a factor. Also, smoking, which I am really not surprised, because the nicotine, when the nicotine is inhaled, it diffuses into the blood system through little air sacs called alveoli, where the gas changes take place. But also there is there's blood vessels there. That's how we exchange our oxygen and our carbon dioxide. However, we also breathe in nicotine. You know, if you smoke, nicotine is also breathed in, and once the nicotine gets in the vessel, it irritates the walls of the vessels, and that sets up a stage of even collecting. Once that wall is irritated, plaque, fat can build up in there, leading to atherosclerosis. It can just be irritated, and it can cause a weakening of the vessel. And so people that smoke are at a greater risk as well of aneurysms. I want to get into some of the symptoms that your body go through when you have an aneurysm. And of course, these symptoms are related to where the aneurysm is. One of the symptoms is blurred vision. Now, I can see where that can be a brain aneurysm, because there's an optic nerve in the brain, and depending on where the aneurysm is, it's going to affect that nerve. And so you can have blurred vision or double vision. Of course, some of these symptoms can also come with different other conditions. So it is not exclusively these symptoms that can say you have an aneurysm. It is only when a doctor diagnoses through specific tests. Also, confusion. If you're feeling confused, loss of consciousness, even for a moment, because that is a symptom that the pressure is building up and blood is seeping out, and that pressure, that ballooning effect, when that blood seeps out, it might be putting pressure on the brain, and so you can have confusion. Also, these are signs that you want to get immediate attention as well, because when an aneurysm bursts, you can have these symptoms as well, and a person can lose consciousness because you're losing blood. These are usually in major arteries, not veins, but major arteries. So when an aneurysm rupture, you can bleed out very fast. And that is why it is so important to really know the symptoms and to get immediately medical attention. When your pupils are dilated, most people, we don't know when our pupils are dilated, but when we look in the mirror, you flash your light in your eye, you can see your pupil, dilate, get big, or they constrict. Well, when you flash a light in your eye, your pupil's supposed to constrict, because it's protecting the eye from the light. Well, in aneurysm, the pupil dilate. Now, you can also have drooping of the eyelids. I've seen pictures of drooping of the eyelid where the aneurysm is really pressing on the eye area. And a lot of time it is one eye that is affected, depending on where the aneurysm is. Also, you have increased sensitivity to light. You can't really stand the light, whereas before you could tolerate light. You can have nausea with or without vomiting. A sign of intracranial pressure within the brain, within the cranial, is vomiting. That is one. Even people with tumors, when the tumor get bigger, they can have increased pressure in the brain, and that can cause vomiting. Also, you have pulsating sensation wherever the aneurysm is. Some people have a pulsation feeling, like they feel their heart beating in their stomach area. And that lets them know that there is some increased pressure in the blood vessels in the abdominal area. You can also have seizures and tremors. It could be brain, or it could be just because of the loss of blood. Sudden severe headache is another sign of brain aneurysm. Now, aneurysm don't have to just rupture at once. It can actually seeps out, but most time it ruptures very, abruptly, and it is really, it's detrimental. You can have stiff neck also, and it's probably because of the pressure in the brain. Now, some of these symptoms are because of brain aneurysm mostly, and some are abdominal aneurysm. Now, I really want to say something about prevention, because some people, they feel that they don't have any, because they hear of people having aneurysm, and a lot of these people, some of these people die suddenly because of the rupture and all the blood, being lost. We have to really be careful and watch for symptoms in our body, and really try to, see our doctor to investigate why we're having these symptoms. It's very important that we listen to our body. We can't keep ignoring what our body is telling us over and over. We have to stop living a busy lifestyle and listen to our body sometimes, and not just listen, but pray about it, and seek medical help, because that is why the doctors are there for you. And so I want to just say, this is a very important subject, but it's good to know, it's very reassuring to know that there are symptoms that we can watch out for, and most of all, there are things that we can do to prevent aneurysms from occurring. As always, I wish above all things that you prosper and be in health, even as your soul prospers.